Welcome back to Health Matters. I'm Dr. Mark Castellaw with Baptist Medical Group. Joining us now is Dr. John Craig, making his second visit as a guest on Health Matters. He is a thoracic and cardiovascular surgeon with Baptist Medical Group. He joins us today to talk about a machine called ECMO, and he's using this to treat patients with serious illnesses like the flu and pneumonia. We're also pleased to welcome Mr. and Mrs. Estele. Cheryl Estele is one of Dr. Craig's patients who was on ECMO. Thank you all for being here today. Now, Dr. Craig, tell us exactly what ECMO is and what that's all about.
So ECMO stands for extracorporeal membrane oxygenation. So it's a support measure for severe acute failure of the heart or the lungs. Some people have a heart attack. Some people fail to come off the heart-lung machine after heart surgery. Other people have a variety of respiratory illnesses that are really incompatible with life. So we have a machine that has basically a heart and a lung in it, basically a pump and an oxygenator that allows us to support whatever the failing organ is, whether it's heart, lung, or heart and lung together.
Now, today's show is about the flu and infectious diseases, so how does this machine play into that?
Well, occasionally, and most of us have had the flu, it's not a serious illness, but occasionally patients will end up with a very, very severe course where they go into full-blown respiratory failure. Some patients end up on the ventilator. Now that can only support people so much, so occasionally it overwhelms the ability of the ventilator to support them, and that's what ECMO is for.
And that's exactly what happened to you. Now, Ms. Estelle was kind of out of it during all this time, so,
Very much so.
Give us a commentary on what happened and how things progressed with her.
Well, it was December 17th. We went into the hospital to Baptist East. And, you know, at that point, we just thought it was pneumonia. That's why the doctors had sent us there. And within about 16 hours, she was from a step-down unit thinking that it was just pneumonia and just needed some rest, into the emergency room where she was then put on the ventilator. And over the course of about the next 8 hours that night on the 18th, her condition just continued to deteriorate where she couldn't support breathing to the point where another one of the doctors in the emergency room came to me and said, you know, we've got one last thing that we can try. We don't know how it's going to work, but we can try to put her on ECMO.
And this all began with just a flu-like illness.
She was just worn out, you know, didn't have any strength, didn't have any endurance. And, you know, we didn't know if it was the flu or, like I said, you know, the first doctor said, you know, it was pneumonia, and that's why we went immediately to the hospital.
Now, again, you were pretty much out of it during all this time. What points of this do you remember?
Well, I just remember being extremely exhausted. I just, to the point where I couldn't even hold my head up. And I was doing a lot of coughing, just, you know, all night long. I couldn't get any rest. And just, those were the two biggest things. And once I went to the doctor, they did an x-ray of my lungs and said, you need to go immediately to the emergency room.
Now, prior to a technology like ECMO, what would normally happen to patients like Ms. Estelle?
Well, basically patients would go on the ventilator and we would provide just enough support to try to get them through. If you provide too much oxygen or too much pressure support, you create more injury. So you hope that during that time of support, their lungs will actually heal. In some severe cases, though, they may overwhelm the capacity of the ventilator to provide enough support, or the disease is so severe that the support you provide adds to the injury, which is not survivable.
And then over a period of time while you were in ICU, after this technology was instituted, you're starting getting better and better.
After the procedure, yes.
Right.
Yes.
Now, during this time that she was in there, what kind of thoughts and feelings were you having during this?
Well, you know, there was the whole world of, you know, where are we at? What are we going to do? How, you know, what time frame? Because as I continued to meet with Dr. Craig and with the other doctors trying to figure out how long, you know, we were going to be on ECMO, and she ended up being on ECMO for 12 days, and then what that recovery period would look like. You know, we were walking through Christmas, we were walking through the New Year, and then trying to figure out, you know, what recovery was going to be after that. So it was a lot of stress.
Now, the technology like this has been available for how long?
It's been used experimentally since probably the 60s or 70s, and then had very poor results in adults for quite a while. So it was mostly a pediatric therapy. But in the past, probably 4 to 5 years, it's really regained a lot of use in adults.
Well, I think the take-home message here is that even though we consider the flu not necessarily as serious disease as it can be, and can lead to a devastating condition like you had. And fortunately, we have the technology led by Dr. Craig that we can institute this process and literally save your life. Mm-hmm. So did you have Christmas later? That's what I want to know.
Well, not really, but
We had parts of Christmas later, yes, absolutely.
We don't want to miss Christmas. Well, thank you so much for y'all being here today. Thank you, Dr. Craig, for being here. Now, next on Health Matters, some advice on how to keep kids healthy this fall and winter. Be sure and stay with us.